Hi guys, welcome to today's lesson, which is about Australia's healthcare system. So our learning objectives today are to discuss some trends in Australia's health, the old public health model, the new public health model, which we also call the social model of health, the Ottawa Charter for health promotion, and the biomedical model of health. Let's get into it. Okay, so Australia's healthcare system. These are some trends which I think are really good to be familiar with. Once again, you don't have to necessarily memorize them, but I think they definitely come up in questions a lot, and it's really good to understand the reasons why these changes have occurred. So females and males' life expectancy has significantly increased. And so the reason why this is the case is because we're less likely to die from diseases simply because we have better treatment for them. And we're going to go into the reasons why that is the case later in the video, but definitely a good one to know. Rates of infectious diseases have decreased, and these are due to vaccination programs and the development of new vaccinations. Death due to cardiovascular disease has also somewhat decreased, however, it is our number one killer. And it's certainly decreased because we're starting to learn more about the causes of it, and it's definitely a preventable disease in many cases. So this is the reason why it is decreased, but it's important not to underestimate that it is still our number one cause of death. And the final one I think you should know is death due to car crashes have almost halved, and this is because we have increased our road safety regulations. Okay, so we're going to be talking about this concept of public health throughout the whole course really, but especially in this video. So I think having a good definition is essential in your notes. So public health is concerned with the organisation and collective effort to improve the health status of the entire population. It refers particularly to the ways in which governments monitor, regulate and promote health status and prevent disease. So I think the main thing here to know is it's all about preventing disease rather than treating disease. And because we're concerned with the entire population, and we obviously can't treat the entire population, we're really working towards preventing the outbreak of disease when we're talking about public health and public health promotion. So our next concept is old public health, and the reason why we're going to talk about this is because we're talking about it in a way that we can contrast it with the new public health model. So the old public health was basically all about developing the infrastructure that we need to remain healthy when health organisations realised that bacteria and the spread of bacteria was causing a significant amount of health issues. So some of the things they did were to establish clean water sources, better sanitation and improved nutrition in order to reduce death rates, largely due to bacterial infections. And then we also discovered vaccinations. So as I said before, this brought huge reductions in death rates due to infectious diseases. And some of you may be aware of the bubonic plague, and this triggered a rapid response from the Commonwealth government, and they set up quarantine laws to prevent huge epidemics like this in the future. So basically, you don't need to know it in too much detail, but I think the key points are that it was to establish infrastructure, as we see here, vaccinations, and quarantine laws. Okay, so now to contrast that with the new public health model or the social model of health. This is a definition which you should definitely know and definitely have in your cue cards and your notes. And it is definitely long, but I think it's also quite repetitive, so it shouldn't be too hard to learn. So the social model of health is a conceptual framework within which improvements in health and well-being are achieved by directing effort towards addressing the social, economic and environmental determinants of health. The model is based on the understanding that in order for health gains to occur, these determinants must be addressed. So basically, it is quite repetitive, and all it's saying is that it's understanding that in order to have health gains, rather than treat diseases, we need to prevent the diseases, and the way we prevent them is by targeting these determinants of health, which will allow people to improve their health status. So the social model has these 5 principles which we're going to learn and understand because they often come up in Saxon exams, and they're definitely part of the study design. So my acronym to remember these is AREAS. So it addresses the broader determinants of health. For A, acts to reduce social inequities, empowers individuals and communities, acts to enable access to healthcare, and involves intersectoral collaboration. One tip before we get into it is this word inequities. Don't say inequalities. Because they obviously mean different things, and a lot of teachers will mark you down on that. And it's basically saying we need to ensure that everyone has the same opportunities, and we're going to focus on the more vulnerable groups, such as our Aboriginal and rural remote populations, to ensure that they have the same access to healthcare as their counterparts which have a higher health status. Okay, so the first one addresses the broader determinants of health. So improving determinants which impact on health, such as socioeconomic status and education. So basically, when it's talking about broader determinants, it means going beyond just the physical. So going towards education, income, which can all play a huge role in our health status, which we've talked about in previous videos. Acts to reduce social inequity, so we kind of went on a tangent with that before, but basically we're addressing those social factors which we've been through in our previous video on the social-cultural factors, including access to healthcare and social exclusion that contribute to inequities in health status. So basically, they want the social model wants to reduce these inequities, so improving access to healthcare for people who may not be able to afford it, for example. Third one is empowers individuals and communities. So this is really ensuring that the individuals and community leaders are participating in the critical decision making rather than authorities being instructive and not allowing community involvement. And the reason for this is supposed to say behaviour, that if we do this, then it's recognised that people are more likely to participate in the healthy behaviours and the regulations which have been passed. Our fourth one is acts to enable access to healthcare. So this is pretty self-explanatory, but it's just making sure that everyone can have access to healthcare regardless of their social or environmental factors. So that can include proximity and income, as well as education levels, and that ties into the term which keeps coming up, which is health literacy, which means making sure that everyone can verbally communicate sufficiently to be able to access healthcare. And the last one involves intersectoral collaboration. So that's just making sure that we're involving all the concerned groups. So that can be non-government organisations, local governments, state governments and federal governments. Basically anyone who has that influence over social and environmental determinants. Okay, so these are some advantages and disadvantages of the social sorry about that. Advantages and disadvantages of the social model of health. Okay, so our most important advantage is that it is promoting good health rather than treating poor health. So this is really going to help Australia's health status to reduce both our morbidity and mortality rates rather than just trying to cure disease once it's already come through. So really we want to celebrate that it's preventing the development of conditions. And we're going to contrast this with the biomedical model of health, which will make more sense soon, but just understanding that we're promoting good health. The next one is that it's relatively inexpensive, and that's because it doesn't involve treatments rather, but health promotion programs are usually more about education rather than using expensive pieces of machinery in order to treat disease. So it's definitely much cheaper. It focuses on vulnerable population groups, so these are like the Indigenous Australians and the rural Australians, and so this is going to reduce our inequities in health, which is of course what we want. And the last one is that it promotes overall well-being. So this is taking a more holistic measure rather than targeting specific conditions. And this kind of ties into our first one here, that we're promoting good health rather than drilling down on diseases which have already occurred. Disadvantages are not every condition can be prevented. So for things such as type 1 diabetes, this social model of health is quite irrelevant. It doesn't promote the development of medical knowledge, and we know that this development is fundamental in order to treat disease, and it doesn't allow that, so it's certainly a disadvantage. It doesn't address health concerns of individuals. So people who are already sick, maybe they were born with a chronic disease, it does not help improve their recovery. So I guess these two tie in together in the fact that some diseases cannot be prevented, and therefore we're excluding these people who are already sick. And the last one is health promotion messages can easily be ignored. So we're relying heavily on public cooperation, which I think a lot of people are aware is very hard, and it's a hard thing to achieve. So it's somewhat ineffective in the fact that it can easily be ignored. Okay, so the next part of this new model of health is the Ottawa Charter for Health Promotion. So this charter was developed by the World Health Organization, and it attempts to reduce our inequities in health. So it's based on the social model of health, and it has its own definition for health promotion. And it employs these three basic strategies, which are enabling, mediating, and advocacy. So we're going to go into them. This is quite a long definition or explanation, but it's certainly the one that I used in exams. Not that it came up too much. You might get questions which are explain the Ottawa Charter for Health Promotion, and you might just need 3 main points, which could be World Health Organization, social model of health, and the 3 strategies. So you definitely don't need to know this word for word, but I think having 3 main points of what it's all about is really important. Okay, so we're going to go through these 3 strategies. The first one being advocate. So this is basically saying we want health promotion companies to actively use things such as media campaigns and public speaking in order to enable people to improve their health. So it's all about the actions, basically, that health promotion companies are going to be taking. Enabling is focusing on providing equity by working with the more vulnerable populations experiencing poor health outcomes, such as our Indigenous Australians. So it's ensuring equal opportunity, and these protective factors such as access to education, employment, housing, nutritious food, and healthcare. And our last one is all about mediating. So it's ensuring that we're using a coordinated approach with all parties concerned. So that might be governments, economic sectors, health and social sectors. So it's basically bringing all people together who are able to contribute to a health promotion strategy. Okay, and so the last thing that we're going to have to go through in terms of the Ottawa Charter is its action areas. And so we have 5, and my acronym to remember these is Bad Cats Smell Dead Rats. So B is Build Healthy Public Policy, C is Create Supportive Environments, S is Strengthen Community Actions, D is Develop Personal Skills, and R is Reorient Health Services. So build a healthy public policy is all about developing legislation to promote health. So that might be a healthy lunch policy or a tobacco tax, basically legislation which really promotes healthy behaviours. Next one, create supportive environments. So this is ensuring that the environment people are living in encourage them to make healthy choices. So that might be having only healthy options at work cafeterias or regular physical activity sessions offered in schools, as a good example. The next one is strengthen community action. So this is concerned with involving and encouraging all people from the community to work together to improve health outcomes. So this could be things such as involving parents in a school approach to healthy eating. And as I mentioned before, in the social model of health, which also employs this target area, it's all about involving people in order to ensure that they will want to participate in the programs which are provided. The next one is develop personal skills. So this is all about education to empower people to make healthy choices. So increasing both their skills and knowledge. So teaching teachers about healthy food choices so they can pass this on to their students and implement it themselves. But if we're talking about food choices in particular, I would say cooking would be a huge one. Because cooking is obviously a skill, and when we learn to cook the right nutritious foods, we're also learning about nutrition and dietary balance. So anything involving skills or education comes under this area. And the last one is to reorient health services. And so this basically means to switch the focus from the biomedical model to the social model, and the biomedical model we'll be talking about next. But basically it's saying we need to switch to preventative approaches rather than restorative. So prevent diseases rather than treat them. Obviously treating them once they arise, but the whole point of this is to reduce the amount of diseases which do arise. So an example is to focus on improving the population's diet rather than funding surgeries. Okay, so our last part of this video is to talk about the biomedical model of health, which I keep on referring to previously because it really does tie into the social model as a way of contrast, because they focus on completely opposite things, I suppose. So whilst the social model was preventative, the biomedical model focuses on the physical or biological aspects of disease and illness. It is a more medical model practiced by doctors and health professionals and is associated with the diagnosis, cure, and treatment of disease. So we are all about treating diseases here, and so this is restorative rather than preventative. So some examples of these include x-rays, stitches, surgeries, medication, and we have advantages and disadvantages. Certainly, our advantages here is that it creates advancements in technology, and you might remember that this was a disadvantage of the social model, that it didn't promote medical technology advancing. It enables common problems to be effectively treated. So this word effectively really ties into those advancements of medical technology, which is going to increase our efficiency of treating common problems. It's going to extend life expectancy because people are less likely to die from diseases that they were previously dying from. And it improves quality of life because people with chronic conditions can be managed with medication, therapy, or surgery. Okay, so our disadvantages. It's very costly because we're relying on very expensive technology. It doesn't always promote good health because it is once again focusing on these quick fix solutions when we're restoring issues rather than preventing them. And it doesn't encourage people to improve their modifiable risk factors because they're becoming reliable on treatment rather than preventing it themselves. Not every condition can be treated, and this is a huge one because our disadvantage of the social model was that not every condition can be prevented, but here we're talking about not every condition can be treated. So obviously cancer has a lot of treatments, but we don't have that complete cure yet. And a lot of these conditions could have been prevented through behaviour change. Or definitely you can decrease your risk of developing these diseases from behaviour change. And the last one is quite expensive to access surgery and treatment, especially considering not everyone can access private healthcare. And this is going to contribute to the inequities which we see between population groups and their health status. Okay, so I know this was a long video and it's a lot to take in, but I wanted to do these 3 components all together because they really link in, and I hope that makes sense. I'll see you in the next video.